Patellar tendonitis or tendinopathy is extremely common in runners, jumpers, or highly active people. The most common used phrase for pain in the front of the knee is patellar tendonitis, but that's just one type of a more broad term, patellar tendinopathy. So patellar tendinopathy is just any general tendon disorder at the patellar tendon. The tendinitis is the acute phase of the injury when there's inflammation. A tendinosis is more the long-standing injury or condition at the front of the knee. So even though people say they have a tendinitis or patellar tendinitis, they likely are out of the inflammatory stage if they're not having pain all the time or swelling. So these treatments are really for those with patellar tendinosis, people that have a longer-standing patellar issue. So just for a little background, we have our patellar tendon here, just right in the front of the knee. It's pretty easy to find. And what I'm going to be going over is just 5 secrets of how to improve patellar tendinitis or patellar tendinosis. So once again, we have our patellar tendon right here, running from the bottom of the kneecap to the tibial tuberosity, which is just the bump right here on our tibia, also known as our shin bone. Of the 5 secrets which I discussed in our online article, the first one is patellar strapping or patellar taping. What you'll be doing, you can just buy a strap online. We have a link on the website where it just runs right across there. And there's different theories on how the patellar tape and how the patellar strapping improves pain and symptoms. But a recent study did show that it improved pain by almost 50% in some activities like a single limb jump. So that's a big reduction in pain. And the idea is that this strap just helps reduce the tension on this tendon. Another method that we use at Core is self-myofascial releasing, also known as self-massaging. Now there's a lot of tools to do this. Foam rolls is usually the easiest way or the less aggressive way. So to do this, you'll just be in the push-up position. You can be on your forearms if you have poor wrist, making sure your spine is nice and straight, rolling not on the patellar tendon, but right on the quadriceps. This muscle runs down to the kneecap, and if the quads are nice and tight, it can cause and exacerbate pain and symptoms of patellar tendinitis. Usually we say go nice and slow. If you find a tender spot, stay on it for 3 to 5 minutes. If you don't have a foam roll, maybe you have a baseball or tennis ball laying around. For that method, what you're going to go ahead and do is have the ball, and you can do the same method on the ground. So once again, we're down here with the ball right on the ground. Woo! Getting in there nice and deep can be pretty tender. Or if you have a heavy bar, you can also use the heavy bar here. Same idea. We're here on the ground, rolling right on the quadriceps. You can also do it in standing. So if you have a wall or something nearby, you're just against that wall, hugging the wall or in the doorway, putting a lot of pressure, once again, just right on the quadriceps or the thigh muscle. Once again, ease into that. Start off light with a foam roll or tennis ball. Go for 3 to 5 minutes finding those tender spots, going nice and slow. The other 3 secrets that you can do is try to improve your biomechanics. A lot of people when they're squatting, they squat with their knees forward. That puts a lot of stress and strain on the patellar tendon. Working on sitting the hips back, getting your glutes more involved. So sitting back like you're sitting in a chair can put less stress on the patellar tendon. When you're jumping, not jumping with the knees forward, jumping from the hips, putting less stress on the patellar tendon. So changing your biomechanics can improve patellar tendinitis. The 4th secret is strengthening the glutes, because if we don't have the strength, we're unlikely to use them. The glutes are the biggest muscle group in our body. So we want to be able to use those large muscles to help reduce stress on our knee. A lot of times people have pain at the knee, but it's really areas in the hip we can improve to put less stress on the knee. The knee's kind of in the middle between the foot and the hip, and sometimes the middle snaps if the other areas aren't doing well. The 5th secret here is just performing or improving our control or eccentric strength of our quadricep. So every muscle contraction or movement has 3 contractions. So we have, if I do a bicep curl, the concentric or the muscle shortening phase, the isometric phase when I'm holding, and the eccentric phase when I'm lowering. So let me rephrase that, make sure you got it right. Okay, the concentric phase when I'm shortening, the isometric phase when I'm holding, and the eccentric phase when I'm lowering. Okay? When you lower, which would be the same phase as when you land on a jump, that's when you have the most force on the body or on the structures. So we really need to have a lot of control and strength to be able to do that. So doing some eccentric strengthening of the quadriceps can be beneficial for building strength of the quadriceps and tendon. So a few things for that is just lowering nice and slow on a squat and then strong up. Okay? You could also be progressing to coming down slow on one leg, up on two, building that eccentric control and strength of the quadriceps, which will also build and strengthen the patellar tendon. So those are our 5 secrets from a doctor or physical therapist for improving patellar tendonitis pain. Make sure you know what phase of the injury you're in, and realize these aren't the only treatments and things that can be beneficial. These are things you can do on your own. If you have further pain or this isn't helping, make sure you see a physical therapist and get feeling better today.